So, good morning. Welcome again to the technology track. And I'm very excited to start this morning with an energetic duo, Dr. Rousselet, who is a dentist who runs a very successful practice between Geneva and Lyon in France. He has a special interest in implantology and aesthetics, but as well, he also founded an association called La Méthode Dentiste Libre, which teaches on how to make a dentist more independent in managing his own practice and find a better work-life balance. And then we have a master dental technician, Simon Gosh. He has a very solid experience in the dental profession, and after studying and working as a dental technician, he concentrated a lot in the digital technologies and has served into many roles in sales, marketing, business development, and now acts as a consultant. So please, a warm welcome to this energetic duo. Thank you.
Come on, Simon. Thank you. So we're going to kind of go back and forth as we move from the clinical components as well as the technological components. So you'll see both of us at different various points in time. And the main premise or the main technology that we're working with is Circle software technology. And basically what it is, the evolution of dental software over the last 20 years has been, pretty significant. We can do some amazing things. And this is sort of a new way that we can work in a cloud-based platform that's AI-driven and very versatile and very broad. And I think, what we're going to do, focused a little bit today on the removable aspects, because the removable process is very, complex, and it's very difficult to go through the multiple steps. But now I think with this iteration of technology, we can do that. So again, being a full balanced suite of capability through all the different aspects of prosthetics. So many of the things that we do with dental software is that we have to have certain elements to its application. So these are sort of the pillars of success that we need to see, and it's sort of a framework of what the Circle software does. You'll notice it has multidisciplinary solutions. So you've got different applications, different software to do different things that we manufacture. And probably the ones that you hear the most of are 3Shape and exocad. They can do removables, they can do crown and bridge, and many different applications. So then the multidisciplinary is very important as opposed to being just a singular software. Then we have to have an integrated solution. And this is very important because then you're not moving from different software to different software, different software. You can keep it all within the same ecosystem. And there's very much a need to have that integration, because then you're avoiding switching, moving from back and forth. So the integration of the solution is very, very important. Where it starts to get now creative and beneficial now for the development of the technology, what we're seeing now is the patient biosimulation. And this is now when we're able to take the movement of the jaw, the movement of the jaw and the patient's custom movements, and we're able to then bring that into the software. And there's companies like ModJaw that track in the jaw movement. So now we're bringing all these things together. And then there's the user experience, right? So some of these softwares are very complex. You need a master user. They're very difficult to use, and you have to go into very deep into the layers of the application. So when you think of a company like Apple, it's a very simple process, very intuitive, and very easy to work with. So this is kind of the family of capabilities that are necessary when the Circle software is developed. So it has all these things, and we'll go through them step by step. So when we talk about, again, the multidisciplinary aspects, we've got to be able to do all the different things that we treat in dentistry. So as I said, today we're going to focus a little bit on the removable cases, because this is sort of what's been left out in a lot of the software applications. Then there's, of course, the tooth-supported capabilities, and then there's, of course, the implant capabilities, which you all know through the Envista product lines that are available. So when you look at the removable, this is sort of the simplicity of working with the system, the treatment planning that we use. You can see it's a very simple platform, and since it's cloud-based, it can be accessed from anywhere. It doesn't have to be on a particular workstation. And here you can see just how the user, clinician, or the assistant can help you work through your entire process. So there's an example of a tooth-supported application, and here you can see now they'll go through an implant solution, and then they indicate the implants in the treatment software. Very simple, very intuitive. You could almost say it's as easy as writing down something on a prescription pad. So again, talking about the integrated solution, and it's very, if again you've been through the world of Envista, you've seen the DTX platform, which is the collaboration nature of the software and integrating all the technologies within the Envista family and sharing the data between different aspects and different people that need to touch the case and see the case, whether it's the lab, the specialist, the treating general dentist. But now, once that comes into the Circle platform, you'll know that all these aspects are integrated into the system itself. So here you can see once it comes in, and there's a variation of scanners. I'm sure you all have different experience with some of the scanners and the different CT scans and all the images that are going to be incorporated into the software. But then once it's in the Circle ecosystem, we can really take an end-to-end solution to the treatment. So you can see we go through treatment planning, biosimulation, the design technology, the manufacturing of the prosthetic, and then moving back into the treatment. So as I mentioned, we're going to focus a little bit about removables today, which is, again, this is sort of the traditional way. We've all gone through the multiple steps and procedures of waxing, flasking, and making and trimming and polishing to make a standard denture. And it's, very laborious, very sort of a lot of back and forth. But you can get a nice result through that process, but very, very time consuming. And then to eliminate some of that time consuming and some of those steps and procedures, we've seen a lot of removables go offshore. So you're seeing, other countries in different parts of Asia, for example, they're able to manufacture, and you get varying capabilities and various aesthetic responses, various aesthetic solutions. So then you look at the integrated solution that we have within the Circle family. You then move to the digital technology. So now we're moving more towards printed and milled technologies, and I think you'll hear a lot about printing and in-office printing or laboratory printing, et cetera. But the printing world over there on the competitive side has a little bit of limitations with respect to aesthetics, because the printed material is evolving, and it's a little different than a flask material and sort of an injected material that we've used in the past. So in the Circle ecosystem, we've got some proprietary technology. We can also do the what's considered the new way of printing and milling removable prosthetics through the same software. But then we'll talk a little bit about some of the solutions and some of the capabilities that we have from a Circle perspective. How the Circle world looks like is that we've got production manufacturing facilities in Europe, and we're going to have some facilities in the North American market, looking towards the beginning of the new year. So biopatient simulation, this is now where it starts to get interesting. And as we, I think the latest buzzword, at least that I've been hearing, is artificial intelligence. So there's a lot of artificial intelligence out there, but it's very important to understand there's different types of artificial intelligence. So there's neuronal artificial intelligence, and there's procedural artificial intelligence. And it took me a while to understand the difference. So now that we do, what we're doing is we're looking at multiple cases. So neuronal artificial intelligence is when you take a bunch of samples of the same thing, and then what it does is it recognizes the image that we're seeing. It then classifies it and then says, this is the best solution for this particular situation. And that's sort of one element of artificial intelligence. Now, it's the procedural artificial intelligence that's sort of rule-based. It's starting to make cognitive decisions similar to how the human brain works. And that's when you have a whole nother layer of complexity to artificial intelligence. And I'll show you how that applies to the Circle software. And so what we're doing in the digital twin component of the Circle software is we're basically twinning and replicating the movements in the actual patient. So that's kind of now where we're moving. And we're experts at this. We've got well over 15 years of data development in the real-time vectorial, we call it vectorial deformation. So this is now the moving and morphing and changing of the positions of the files and the data that we work with. Because traditionally it has to be done by hand and layered over top. And all the data and the code that we have is very, very unique to the Circle software. So here's a great example of vectorial deformation. And you can see it's moving the different files and the different scans, and it's bringing them together in the same file. So here you can see now how we pull the files together. It's working together within the process, and we're layering over the different scans and the different data that we have. Traditionally has to be done and moved back and forth. So this again now is where we really start to get sophisticated. And this is now when we're going through the actual jaw movement of the restoration that's now being changed and manipulated into the software. So as the bite forces are moving through the occlusal contacts of the teeth, we're now adjusting the movements of the patient. So you can see the level of sophistication now in comparison to what a traditional design technology is, very say with occlusal planes. So this is really now, as I said, where we start to get very unique. And then we've got the user experience. So traditionally, I know for those of you that have worked with the laboratory, you're constantly back and forth between telephone calls, between emails, texts, and WhatsApp, and you lose a lot of information and you lose a lot of efficiency. But the nice thing about the Circle system is that it's cloud-based and you have virtual access from anywhere. So it's all, the communication is then made through the platform. So it's a very efficient process to be able to communicate back and forth between the dentist and the laboratory and the designers. So you can see, as you see, you've got a very simplistic work pad. This is something that can be done very easily by an assistant. And when Bertrand goes to the clinical, you'll see how he's working with it, almost like how you'd be charting periodepths. But it's guided, so depending on the treatment that it'll tell you which procedural treatments you're going to do, which scans you need. Everything is guided through the software, so you don't have to wonder what's going to be happening. You're not going to get the phone call that says, I'm missing this bite rim, or I'm missing this, or I'm missing that. It's all taken care of itself within the software. Then you can see now as we start to move into the design, we'll get a little more in detail, but now we can move, change to all the positions. And what's really interesting, and we'll show you through the design phase, is the importance of now being able to build with all on the same platform. Because if we were building with the cast partial framework versus building with the acrylic versus building to where the occlusion is, we've got a lot of different things going on at the same time. So to make it intuitive and make the user experience exceptional, that's going to be a more efficient workflow. So this is what we're trying to atone for. We're trying to get maximum chairside efficiency, so minimizing the amount of appointments, high precision fit, and basically all the prosthetics. So what I'll do is I'll turn it over to Dr. Bertrand Rousselet, and he will go through the clinical procedure.
First of all, I will try to be as fluent as Simon in English. So I will try. Secondly, I will tell you one thing. My office is called IES. I means integrity. We say what we do what we say. E means expertise. When we integrate a new system in the office, it means three things. It's faster, it's easier, and we won't charge much more the patient. And S means satisfaction for the dentist, for the patient, for the team. In my office, we are 8 dentists, 13 assistants, 1 manager. Each week, we have between 35 and 75 new patients each week. So we have all rationalized to go good and fast. And the small part of the old dentist is removable prosthesis, because it's not very sexy and you don't charge really much the patient. So when the Circles team came to me and told me, we got the solution, okay, let's try. My job is doing grafts, implants, veneers, but the whole team is doing general dentistry. And when we decided to include the system, it was to give satisfaction to the patient, go faster, less time, and charge not more. This is Pascal. Pascal is 61 years old. He wants to eat, he wants to smile, just normal. But he came to me. Normally, I would have said, okay, I will put some implants, I will graft, I will put some veneers, but he has 2 problems. He wants an affordable solution, and he wants to go fast. Because at the beginning of September, he has a new job. So, forgot the implants, forgot the graft, forgot the veneers. And we have to find a solution cheaper, a good solution but cheaper, and a fast solution. So we decided with him to put a full denture at the upper jaw, a partial at the lower, and 2 bridges. So, as you can see, we decided to extract the teeth. We made together the decision. I've explained it all to him, so he's okay with that. And our challenge, when I first met Pascal, we were on the 15th of June. His new job is for the 5th of September. I will go away of the office for 5 weeks and the laboratory for 2 weeks. So we have to do it good at the first time and quickly. First appointment. Simon said, first of all, you have to give the lab the best information they need to do the good job at the first time. I like this explanation, gigot, garbage in, garbage out. So the first appointment is quite simple. It would take maybe, if you do it all, it's 40 minutes. If you delegate, as I do, it's 10 minutes. You just have one of my assistants has an iPad. A 5-year-old kid can do it at his place. You speak aloud to the assistant what we are planning to do, and what we will comment to the lab. The type of reconstruction, removable, fixed, the kind of material we use, the kind of shapes, the shade. Really simple. Then you will scan the patient, the shade. You will scan the patient. In my opinion, if you want to go faster and easier, you have to scan the mouth, the nose, and the face, so that the circle will be able to, comment tu dis, yeah, put everything together. Thank you. And as I told you, in my practice, I use neuromuscular dentistry and the COIS process. So I'll do the same. And at the first consultation, I ask my assistant to take prints and to make a COIS plate. As you have seen, Pascal abrased a lot his teeth. So we have got to increase the vertical dimension. I use stents, I use COIS plate, but if you don't use those systems, you can ask Circle to increase the video on what you want, okay? And then you just have to complete the interface, control it, put all the stuff in it, and done. Then you took pictures. You take extraoral pictures. It's done. Laboratory can do it at that time. Simon.
Thank you. Cool. So as we go through the laboratory procedure now, all the information, the records has now been received through the system, and it's now in the laboratory. So now we go through the process, as I was mentioning, the digital twin. So this now, you'll start to see how the software will take all the data and merge it together. So it's bringing and morphing the information, so we're overlaying it. And you know, we're not just taking files from one scan, another scan, and trying to move it together. This is now integrating within the software platform. So now we have all that information now to design the case and work with the case. And you can see there's any variation of the scans, so forth, that we need. This is now the, with all of the different scans, you've got a face scan in there, you've got an intraoral scan, you've got now the development of the scan, and we have to now virtually remove the teeth. And this is another aspect of the software of what we can do. So we have to then identify the teeth that we're going to extract, and then we're going to, you know, keep moving through this process. This is a relatively, again, automated process through the software. You imagine in the traditional way, we'd be grinding the teeth down out of a stone model. And you'll see this as we go through the clinical aspects of the case, just now how we can work through this. So now we're simulating the removal of the teeth within the software, and now we're going to bring in the bite components. So now with all the information that we have, we're then going to change the position of the bite. And now we're balancing this with the face and all the occlusal planes and all of the visual planes. And this is all happening in the software. So this now is where we're moving, increasing the vertical dimension. And then moving back to the design process of the prosthetic. So this is now, if you're familiar with design software, a lot of the componentry has to be done in different phases, right? So if you're making a chrome partial framework, if you're making the acrylic portion and the occlusal portion. So what we're doing is we're designing in the same platform the three different components of the case, which is the occlusal of the teeth. There's the soft acrylic, or the pink portion that we're putting in, as well as the framework portion. So all of this is being done by the technicians and through the design phase. And in this particular aspect, we've got a titanium plate, but you can see now we're just moving through the design phase and moving through. And this is for the provisional. So we're going to show you the provisional phase, and then we're going to show you the final phase. So, and this is, again, the stuff that's done inside the laboratory. And this is where you now have a pretty good visualization of what the outcome is going to be. We can change the material that we want. We can modify any of the clasps in real time. And again, this is, it's fascinating when you see what the designers are now capable of doing at the laboratory level. So now, again, we're designing at the same time occlusal plane, the teeth, the substructure, and the acrylic. So this is what I mean by the integrated solution. And here you can see what we've got is a PMMA substructure and temporary provisional that's now ready to go back to the clinic.
What I forgot to tell you a few minutes ago is that we've got at the office Mojo, SmileCloud, DSD, but as I told you, I can charge Pascal. So Circle make the job for me. I have nothing to do. Just put the information, the data in the system, and it's their business. It's not mine. At the second appointment, if you are an implantologist, it's the same. You do the same job. You want to preserve bone, so you do smooth extractions. Maybe you put some PRF, as I do, because I want less pain and I want the healing go faster. Extract the tooth, as I always do. If you are implantologist, you can do the same. And then, sometimes, in a normal life, 9 months ago, this was the beginning of the scary movie. Why? Because when you have this parts, you don't know if it will be good or not, if it fits or not, if it's painful or not, if it's aesthetic or not, if it's functionally perfect. I can say you one thing, the system works. If not, I won't be here. So we extracted the teeth, maybe 2 minutes to put the full denture, no adjustments. And then we go back to the lower jaw. As I always do, I put a first mock-up to cut the teeth to stay in the enamel. Remember that we increase the vertical dimension. I want to stay in the enamel. So my first mock-up is to control the occlusion and to stay, to cut as minimum as possible the teeth. Then I control the occlusion, I control the space between the upper jaw and the teeth, and then I put the second mock-up, which will be the provisional one. Small adjustments. This is the preparation of the teeth, and then you put the second mock-up, and as you will see, we took comment tu dis une prise de vidéo? One shot. In one shot, we put the provisional bridges and the partial denture went smoothly adjusting with the provisional teeth. This appointment took 1 hour and 10 minutes for the extraction and the preparation of the mouse. You control the occlusion, static, dynamic. You control that the lab will have enough space to put zirconia. You seal and to put the removable denture. And then you will go to the studio to take some picture to show Pascal if he's confident with his new smile. Okay. Here is Pascal, the new Pascal. Okay, we've got a difference of shade between the upper jaw and the lower jaw because we don't use the same material. It doesn't matter. It's not a problem. Then, Pascal, we go away for 5 weeks, and then he come back for the third appointment. At this appointment, you will have to ask him, do you feel pain? Are you comfortable? Do you like your smile? What did say your kids, your family? Okay, can we go further? He said yes. So we rebase the full denture, scan it, done for the definitive one, 10 minutes. Then you you take off the temporary bridges, you will put a retraction cord, take the prints, you will divide the temporary bridges by 2, you will take the occlusal part without the bridge on the right side, you will re-put the right, you will take off the left side, take the occlusal relationship, tell Laetitia to implement the interface, what kind of full denture you want, the shape, the shades. If you have any information to give to Circle, you can write it. It's done. Maybe this appointment took 40 minutes. I just also would like to say something. You know, in the oldest world, sometimes when I had an appointment, maybe 24 hours just before the appointment, the laboratory called me, we are late. Can you delay the appointment? Never happens with Circle because it's a manufactured system. It's not handmade, so never
delays.
Yes, never.
So now we sort of come back. We've got all the records back, similar to the first. So we did basically case planned the removal and the temporization, and now we're case planning the final. So this is now the laboratory procedure, and this is again where you look to the level of sophistication of what we're doing here. It's now a completely digital process that's manufactured. You can see the CAD design. In this particular instance, as I mentioned, we're going to be doing a titanium pallet that's all milled and manufactured. All of the information is then produced digitally, and we're going to give them a representation back to the clinic for what the final restorations are going to look like. And now you can see, as you start to think about everything that we've just showed you, based on the information, the digital information that we've received from the clinic, we now have the digital case plan, the digital manufacturing process, and now we're going to the final phase, which is now the final development of the case.
Okay. As I told you at the second appointment, no scary movie, because everything is predictable. So, Pascal told me on the 5th of September, I gotta have my new teeth. We are on the 29th of August. So we'll place the definitive prosthesis. This appointment took 40 minutes. Take off the bridges, take off the full denture, place the upper full denture, look at the bridges with precision adjustments, full zirconia, no pain, really stable, middle in the middle, corridors correct, axis vertical, and then you try the passivity of the bridges, right side, left side, and forward, posterior side. And then you will control the occlusion without the removable denture. You see if it fits. If it's well, then you will try the removable denture. After fast trying, you will have to cement the bridges and then re-put the provisional denture, make some small adjustments. It's done. 40 minutes. If you count well, in a normal life, that kind of treatment could take maybe 8 or 9 appointments, and you can double the amount of time you spend at the chair side. In my opinion, we've got to delegate the maximum of things, and we've got to minimize the time we spend chair side. We control the occlusion. Finished. Pascal is okay. This is the dentist view. Okay, middle line, axis, corridor, everything is okay. Occlusion is okay. But this is the most important thing for me. This is the S of satisfaction. Okay, it's not implants. Okay, it's not graft. Okay, it's not veneers. But I can assure you that what Pascal told me at the end of the appointment, he told me the first feast I want to spend is with you, to have a dinner with you. Before working with Circle, I hated removable prosthesis. I never did. I redo. So the game changer is 2 appointments per treatment, reducing the chair side you spend in your office, and the most important, patient comfort. At that time, I do think that Circle is a solution for a removable solution. And now I can say one thing is we are trying to implement the system with implants to maximize to minimize the use of many tools like Mojo, SmileCloud that I use. I enjoy them, but if you want to treat more and more patients, if you increase the charges, you will treat less and less. That's my opinion.
Yeah, so as we conclude, as we sort of wrap down the clinical, and that was a very complex case, obviously. If you imagine just a partial denture and a regular edentulous patient, the simplicity of using the Circle process to accommodate that, then it very, very much simplifies the steps and procedures. So again, you can see now how we incorporated, again, the circle of success here. The multidisciplinary applications, so as you're combining partial dentures, implants, and all the different things that you can do to treat a case, it's now working within the same platform. And that is gives you a lot of capability. You're not moving from platform to platform. It's all integrated. The solution is integrated within the system. We're not going from software to software to software. It's all self-contained within the system, so there's less variations along the way. And for those of you that have been digital for a while, you know that there's digital variations as you go through the different manufacturing processes and different procedures. Well, it's completely integrated within the same solution, so we're not moving and using different disparate softwares. The biosimulation, as you see, the key to this whole thing is the success of how it works together in harmony with the patient. And the patient we're doing that by replicating that process within the software. So when we're not just taking an interpretation of what a dental technician thinks this is going to be, we're now taking the records and the actual data from the patient, and we're able to convey that back into the final restoration. And you could see the simplicity in the amount of adjustments and occlusal adjustments in the process for a very complex case. Crown and bridge, partial dentures, and then the occlusion. And then the user experience. What you see clinically is a lot different because everything is managed on the manufacturing side by Circle. We're doing it all. And you're basically giving the right information in a very simplistic process that you can get access to. So the user experience is very high. And then just obviously with frequency and repetition, it continues to get easier and easier. So again, chairside optimization is the name of the game here. And so you're taking it from complex cases all the way down to simple denture cases. We want to optimize the chairside time because if you're not making as much money, the more efficiently you can manufacture the case for the patient, the profitability is going to be there. So we want to help you manage your chairside time. you have to give a quality product at the end. You know, we've all seen bad dentures, we've all seen bad removable prosthetics because it was just sort of an afterthought. Well, I think now if the standards of your practice, you can then deliver very high levels of quality, even for the patients that can't afford, you know, the Midas touch. One of the things about there is no fees, there's no contracts to the software, and you know, I'm sure I don't have to tell you guys about software licenses and things like that. I'm sure you're paying enough of those. So that's one of the nice things. It's a user application that works within the Circle ecosystem. So that's it. You know, thank you very much. And this is sort of new to the Envista world, and I think you'll start to see more of it as it advances, and we start to release more of it. I mean, the response that we're getting back from the clinicians that are working with us are extremely satisfied, and you can see by, you know, Bertrand's experience on the case. And you can imagine as you work through simpler cases, you know, how much more efficient they can become. So thank you very much for your time. We appreciate everybody for, you know, the last day of the conference and making it in. So thanks very much. We appreciate it.